which is important from the SC point. But before we do that, we need to clarify a few things. The first is keratoplasty. Now, what is keratoplasty? That is the big question. Kerato, it means cornea, and plasty, it means it's right from transplantation. So basically, a corneal transplant is called keratoplasty. What are its types? Does anyone know? So a keratoplasty, it can be divided into two types. So let's just say that this is the cornea of our patient. If we remove the whole thickness of the cornea, we transplant a newer cornea in its place. That is a full thickness or a penetrating keratoplasty. That is the first type of keratoplasty. The second type is that if we do not remove the whole thickness of the patient's cornea and we transplant only one layer, only a part of the cornea, let's just say. That if we're, let's just say we're transplanting half of the cornea from over here, from this patient, from the donor to our patient. So that is lamellar or partial thickness. So when we have keratoplasty, we have two important terms. The first is full thickness. It's also called penetrating. The first is a full thickness or a penetrating keratoplasty, in which we transplant the whole thickness of the cornea. The second is not full thickness. It's called partial thickness, because part is being transplanted, and for the same reason, because only a few layers are being transplanted, we also call it as a lamellar keratoplasty. So we have two types: full thickness and partial thickness. Now, each of these, they have their own indications and their own contraindications as such, and also their own therapeutic use. And this is a broader term. This is based on the thickness, not the technique or anything else. So it's more relevant to our anatomy. Full thickness and partial thickness keratoplasty. A partial thickness, it can be either anterior lamellar or deep lamellar. There are two terms: anterior lamellar and deep lamellar. What do these mean, and what is the difference between them? Anterior lamellar means that this thickness, this partial thickness lamellar keratoplasty, it includes some part which includes the epithelium, the Bowman's membrane, and part of the anterior stroma. So if I transplant this onto our patient, this is an anterior lamellar keratoplasty. But if I say take a lot more than just this anterior part, if I take all of this part, this whole, sparing the Descemet's membrane and the endothelium, and if this is transplanted onto our patient's eye, this is a deep lamellar keratoplasty. It's still lamellar because the Descemet's membrane and the endothelium, they're being spared. We're just transplanting almost all of the stroma, the epithelium, and the Bowman's membrane. And this is a classification that you should remember, because one of these is a treatment of choice for a disease we'll be discussing today. So we have a few miscellaneous topics. Well, a few, and one very important one from the SCP. We'll move on to that. So our first topic. These are two conditions which present with rings in the eye. So can you identify the ring in the first picture, the picture on the left? Anyone at all? Koi bata de?
Arcus Analysis.
This is an Arcus analysis, but how do we know it's an Arcus analysis?
Because it's a ring around the limbus.
It's a ring around the limbus. So there's a ring or a pacification in the form of a ring around the limbus. You can see it's somewhat inside the limbus. If I were to show you, now this is the limbus. There's somewhat, there's a mild clearing over here. थोड़ा सा clear area आता है. उसके बाद there's this opacity, and the rest of the body is clear. This is an Arcus Analysis, which Arcus means an arc shape. It starts from the arc, it forms an arc at the top, an arc at the bottom, and then becomes a complete ring. Sinalis due to. So Arcus Analysis is a senile or a geriatric finding, and it's asymptomatic. It's asymptomatic. This means that it's a normal finding in people with related to age, and it does not cause any symptoms at all for the patient. So it's an important thing to know, because most of the time when we see our grandparents or any elder in our family, it's most likely they will have this condition. My grandmother also has an Arcus Analysis. So it's good to know this. But at the same time, this is also a condition which has rings, which has a ring in the eye. ये क्या है? What is the color of the ring?
Grayish?
It's brown. It's brown. This is the ring, right? The first thing is that we have to identify something peculiar. This is the ring, which is around at the limbus, and it's either brownish or deep orange in color. Right? You guys already know what this is. क्या है ये? What is this? थोड़ी सी मैं हिस्ट्री बता देता हूँ. This patient, he has liver disease. Secondly, he has a melismus or a chorea or a movement disorder in general broad terms. This patient who presents to you with a brown ring in his eyes, he also has a liver disease, and he also has movement disorders. What is your diagnosis? मुझे आवाज नहीं आ रही clearly. Try to answer it. Hemo?
Sarcoidosis.
Someone said hemosterosis. The other person, आप क्या कह रही हैं? दोबारा बोले, आपकी आवाज नहीं मुझे आई.
Sarcoidosis.
Sarcoidosis. So we have two diseases. Someone said hemosterosis. The first part of the hemo is right, and second is sarcoidosis. I want both of you to tell what's sarcoidosis and what is hemosterosis. जिसने hemo बताया है, hemosterosis, and that person, please tell us what is hemosterosis.
Hemosterosis is excess deposition of iron.
It's excess deposition of iron. All right. So what are the symptoms of that excess deposition of iron in the body?
There's brown pigmentation.
Brown pigmentation. All right. Where is that brown pigmentation?
Skin?
In the skin. बिल्कुल skin पे होती है. First thing is that in hemosterosis, the brown pigmentation is on the skin. The second thing is that hemosterosis usually does not present with movement disorders. It presents with diabetes. That's why the term bronze diabetes is used for hemosterosis. First part of hemo is right. We'll come back to later. The other person, they said chalcosis. Now, what is chalcosis and why do you think this is chalcosis?
Sarcoidosis is deposition of copper.
All right, it's a deposition of copper. That's good. And
it forms a ring.
It forms a ring. What is the context of chalcosis?
What is the
context of chalcosis?
I didn't get your question.
Question is that chalcosis does not happen on its own. There needs to be a trigger or something that precipitates that condition. So chalcosis, she's correct. Chalcosis means a deposition of copper, and it's signs and symptoms which is caused by the deposition of copper. Our chalcosis, when we discuss chalcosis, chalcosis occurs after trauma or after copper finds local deposition or has been locally introduced into the eye. Meaning that if there's trauma by a copper wire, etc., or anything, or a copper metal is introduced in the eye. So whenever you think of a diagnosis of chalcosis, think, is there a trauma? Or if it's trauma, then if there's trauma by any copper, metal copper, and chalcosis, it has another few different signs as well. There's a cataract in chalcosis, there's other signs of trauma, there's a ring as well. So chalcosis is this constellation of signs. हम ये discuss करेंगे when we will discuss ocular trauma. And one of those signs is a ring. Now the chalcosis is the condition, the ring is still the sign. What is that ring called and what is this disease? These are my two questions.
Wilson's?
दोबारा repeat करना.
Wilson's disease.
Wilson's disease. So diagnosis is Wilson's disease. Because in Wilson's disease, the other name for Wilson's disease, does anyone know the other name for Wilson's disease? Like Wilson's disease, the other name for Wilson's disease is hepatolenticular degeneration. Hepatic leads to hepato, and lenticular, it means lenticular nuclei or the basal nuclei, the basal ganglia. Wilson's disease. Wilson's disease presents with a liver disease, movement disorders because the basal ganglia being affected, and a ring in the eye. What is this ring called? That is again my question.
Kaiser-Fleischer ring.
Kaiser-Fleischer ring, right? This is a Kaiser-Fleischer ring. You have to remember this because this is an MCQ. Wilson's disease, or if you have a patient who has three things: a brown ring in their eye, who has movement disorders, and a patient who has cirrhosis or liver disease, or if his eye is jaundiced, then you will think Wilson's disease. The ring, this brown ring formed in Wilson's disease, is called Kaiser-Fleischer ring. Right? This Kaiser-Fleischer ring is similar to Arcus Analysis in the distribution. It forms a circular or ring at and around the limbus, and it's brown in color. What is this actually the deposition of? What is being deposited over here that forms this ring? Due to deposition of
Copper.
copper. So we know that in Wilson's disease, copper is in excess. Excess means बहुत ज़्यादा है, and that is deposited in the eye. So Kaiser-Fleischer ring जहाँ भी आपको लिखा हो, think Wilson's disease. But both these terms must be present. Both the terms meaning that Kaiser must be present and Fleischer must be present as well. Because if it's only a Fleischer ring, then it's completely different. Kaiser-Fleischer ring में और Fleischer ring में फर्क है. Keep this in mind. आपने अभी मैं आपको थोड़ा और confuse करता हूँ. So these are two conditions in which we have rings in the eye. First is Arcus Analysis. It's a common finding due to age, and the second is Wilson's disease. Arcus Analysis, it occurs in older people, elderly, around 60, 70. But if it were to occur in middle-aged people, let's say around a person whose age is 40, 45, 35, then this Arcus Analysis would be termed as
Juvenilis.
Arcus Juvenalis. Arcus Juvenalis. Okay, the Juvenalis does not mean it's occurring in juveniles, which is for the age group of 10, 15, 9, etc. Arcus Juvenalis is just an arc which is occurring earlier than usual, or earlier than Arcus Analysis. Arcus Analysis, it was a common finding due to senility, age. But when we have an Arcus Juvenalis, or the same arc in a patient who's much younger, there's a thing we need to look out for. There's something we need to do. There's a test we need to perform. usually a clue, and it's based on pathophysiology. Now you have to relate the pathophysiology with cutting. Whenever you find a patient who has an Arcus juvenalis, check their lipid profile. Then you have to screen them for lipid disease, for hyperlipidemia, hypertriglyceridemia. Okay? In a patient who you find of Arcus juvenalis, check their lipid profile. क्यों कहते हैं? Think about it. We will discuss this in a little while. These were two conditions in which we have rings in the eye. The first is Wilson's disease, and the second is Arcus juvenalis. Wilson's disease will not have any history of trauma, and Arcus juvenalis is a senile find. We will have a constellation of signs, including a cataract, a sunflower cataract, eyes of a history of intraocular trauma, and on investigation, we may find even that piece of copper metal that is causing that disease. So, chalcosis is that constellation of signs which occurs in trauma, in metallic trauma due to copper. We will discuss that in our further sessions when we discuss trauma. And hemosterosis. Hemosterosis does not cause a ring, but hemosterin is deposited as a ring in another disease. We will discuss that later. Now, what is opacity? You already know what this opacity is. I've shown you this picture before, and I used this part to this part over here to give you the concept of glaucoma, and this part over here to give you the concept of macula. But that was the nature of the opacity in what we can clinically say or tell about it. But what is this disease actually? That is why we're here for. These two pictures are of the same disease entity. I just want you to describe this picture. What you're seeing and what you're not seeing.
A corneal opacity covering the pupils.
There's corneal opacity in the pupillary area in the visual axis, impeding the visual axis. That's good. What is the shape of this corneal opacity?
Rectangle.
It's rectangular. It's rectangular, or if we look closely enough, we can see that it's somewhat oval. I can trace the margins from over here. Oh, this is too big. 3. I can trace the margin from here. It's going over here. And it's going back. So somewhat rectangular, somewhat oval. What is this exact location in front of the cornea? We discussed this area many times. ये जगह क्या है कॉर्निया की?
Intermarginal.
Yes, it's the intermarginal strip where the eyelids they meet each other and they close sometimes. So we have an opacity, and it's oval in shape, rectangular, or somewhat oval in shape, located at the impeding the visual axis, located at the intermarginal strip. Now, a few important negatives. First important negative. क्या है?
Inflammation नहीं है.
Inflammation नहीं है. There's no sign of inflammation. There's no circumciliary congestion. There appears to be no KP or no uveitis. So no, there's no hyperion in simpler terms. If I were to perform a sodium fluorescence staining, it would not stain, meaning that this opacity is not a corneal ulcer. So on our hands, we have lesion, which is not an ulcer. Now you will think about it. So we have a lesion, which is not an ulcer, not inflammatory and not an ulcer. So the first thing is that we have a lesion which is not inflammatory and it's not an ulcer. And the second thing, I'm going to give you a bit of context clue. This is suffering from vitamin D deficiency. Or this patient can be suffering from hypoparathyroidism. or this patient can be suffering from chronic uveitis. We don't see the signs of uveitis in this patient. He can be suffering from chronic uveitis. Or this patient is a child and he's suffering from Still's disease. I've told you a lot of associations, 4 associations to be exact. What is this lesion? क्या है ये? It's actually sorry, it's the opposite thing. It's hyperparathyroidism and vitamin D poisoning, not deficiency. This disease, it's called band-shaped keratopathy. Strange name, but band-shaped because the lesions they appear band-shaped, or they're usually in a band-shaped margin along the intermarginal strip, palpebral area, and keratopathy because it's a degenerative condition and there's no inflammation. That's why it's not a keratitis. Now, why I'm telling you this strange disease, because it's important in the context of MCQs and why this happens. Because they ask you how do we treat a band-shaped keratopathy. They give you this clue, these context clues. The patient was overloaded in vitamin D. The patient is suffering from Still's disease. They're suffering from chronic uveitis. They're suffering from hyperparathyroidism. It's not that conceptual, but the thing is that this is due to actually degeneration of the epithelium and the stroma. And after degeneration, is deposition of calcareous salts, calcium salts, inside the stroma. So it can either be confluent, like in this picture, in which the opacity is somewhat uniform over here, or it can have an opacity which has clearances in the middle. I'm hovering the mouse. So, how do we treat this band-shaped keratopathy? Treatment is very simple, and you studied this treatment in pharmacology, in forensic sciences as well. The treatment is EDTA. What is EDTA? EDTA क्या है?
Chelator?
It's a chelator, right? It's a chelator. Ethylene, diamine, tetrahydric acid. I'm not sure of the name. It's a chelator which chelates those calcareous salts, and it is a treatment for band-shaped keratopathy. Now, these 3 things which I've just mentioned: EDTA, band-shaped keratopathy, the concept of chelation, and the cause of calcareous salts. These are important from an MCQ point of view, and in this MCQ, it's a favorite of ophthalmology part in the send-ups, and sometimes it also comes in prof as well. Band-shaped keratopathy, it's caused by degeneration and deposition of calcareous salts. And how you need to treat this? You need to treat it by using a chelator, that is EDTA. And it occurs in the context of vitamin D poisoning, hyperparathyroidism, chronic uveitis, or Still's disease. So,
chronic uveitis में hypercalcemia कैसे होगा?
hypercalcemia का उससे relation नहीं है. Hypercalcemia does not actually have a relationship with this. This is due to the deposition of calcareous salts as well. It's not due to hypercalcemia. There's something, there's degeneration, extracting the normal calcium in the serum, in the blood, or in the fluids to come and deposit itself at that area. Okay, so hypercalcemia does not need to happen. That degeneration is attracting normal calcium, normal salts to deposit in that area. So no, there's no relationship with hypercalcemia as far as I know. But this is an MCQ and it's important. So band-shaped keratopathy. In the next case, it's very important because they ask you for the signs of this disease and they ask you for the treatment of this disease. And the most important of the buzz statement which we give you whenever there's a question stem or a clinical vignette is this: astigmatism that does not correct with classes. So when we discuss this term on the basis of this statement alone, there's astigmatism that does not correct with classes. What do you think? Do you have anything in mind? Does anything come into your mind? All right. Since nothing comes into your mind, we're going to review this patient further step by step. So this is the only history we know. There's no other history of this patient. So the important pertinent aspects or things in history is that he's pubertal. So let's say our patient is 19 years old. She's a female and she's a college going student. She started developing astigmatism around 2-3 years back. And for first, in the start, she used glasses for astigmatism. It was controlled. But recently, she's saying that she still is not able to see or still has blurry vision and other symptoms of astigmatism. And she's frequently changed glasses and her symptoms are not resolving. So, important pertinent points in history. 19-year-old female, history of frequent glasses change or uncontrolled myopia, or simply astigmatism not corrected by glasses. On examination, these are some of the examinations in one investigation. I'm going to ask you what is the abnormality you see. First picture we have. Ask the patient to look towards her right. This is her left eye because I think this is the lacrimal puncta behind. And on slit lamp examination, this is what you're seeing. So is this normal or is there any abnormality which you're seeing?
Bulging cornea.
bulge हो रहा है.
Bulge in the cornea, right? So this is the limbus, and we can see that there's this bulge in the cornea. So a patient who has a bulging cornea, there are a few differentials which should come into your mind. And the topmost differential is, what is the topmost differential? Keratoconus. So this patient has a history, and her age. So if you're thinking the top differential is keratoconus, all right. So there are a few signs of keratoconus which we should be able to see in a person who has developed the classical signs or disease has progressed enough. So we can see a bulging cornea on slit lamp examination. Now I ask this patient to look downwards. मैंने उसे कहा है कि आप नीचे देखें सर हिलाए बगैर. And I'm gently, I have my thumb just above the upper lid. So I'm retracting her upper lid. And when she looks downward, this is what we see. This is a very peculiar sign. It's specific for this disease or any corneal bulging. This sign, it's called
Manson sign या Manson sign.
Manson sign. So Manson sign होता क्या है?
जब पेशेंट को कहता है कि नीचे देखे तो लोअर लिड थोड़ी सी आगे की तरफ मूव करती है, बल्ज करती है.
So Manson sign के spelling मैंने काफी गलत लिखे हैं. You get the idea. I'm not going to correct it. Manson sign is that when a patient is asked to look downwards, there's a bulge in the lower lid as well due to the bulging of the cornea. Meaning that if this were to be a normal patient and normalized and had normalized like you and myself, तो फिर क्या होता if for the patient to be looked downward? Lower lid, the boundary of the lower lid would have been like this, normal, somewhat normal. However, you can see that there's this bulge. Okay? And this bulge is greatest over here. It's not uniform in nature. It's not uniform, this lower lid margin. and this bulging into the lower lid, this is called Manson Sun. And the patient is asked to look downward. So there's a bulge in the lower lid due to the cornea. That bulge is called Manson sign. Normal cornea इस तरह चले जाना चाहिए था, but there's something which is pushing the lid away. That's the cornea, and this is the Manson sign. So the first important sign, you have to remember these signs. The first important sign is Manson's sign. Secondly, moving on to this slit lamp examination. This is an artifact due to light, this is an artifact due to light, this is an artifact due to light. The light की वजह से है. So in this examination, we can see that a slit is visible to us in the slit, and these findings in the slit. Can you appreciate the findings in the slit?
The lines that were visible.
Yes, there are some lines visible. What can you tell me about these lines? These are lines. All right, first thing. और क्या है?
थोड़ी सी arrangement शायद.
Arrangement बिल्कुल, they're parallel. And they're parallel, and where are they looking, or where are they, what's the two ends? One end is superiorly, and the second is somewhat inferior. So the parallel lines in in the cornea, in the corneal stroma, these are called, this is another sign, an important sign. These are called both stria. Stria for stria because of the lines, and vote because the person, I don't know, बंदे का ही नाम है इसके ऊपर रखी है. So these are vogue stria. These are the second important sign, and this is the second important sign of keratoconus. And what these are, they're actually parallel lines, or parallel lines inside the corneal stroma. And these parallel lines, their direction is towards the apex of the keratoconus. So what does this mean? We can see that the lines, their general arrangement is somewhat along this. इस तरह जा रही हैं. ऐसे ही है? It means that either the apex of the keratoconus is somewhere over here, or it's somewhere over here. Usually keratoconus is there, okay, just below the apex of the cornea, just below the frontal. यानी कि अगर pupil यहाँ पे होता, the normal cornea, this is the pupil, and this is the apex of the cornea in a normal person. The maximum point of bulge in a keratoconus will be just inferiorly. So these four stria, they are an important sign of keratoconus. Now I'm ending this session. I'll be back in a minute. You have to tell me what causes these four stria. Jaldi se dekh lo, and you will tell me what is the cause of these stria.